Okay, sorry about that. Got interrupted by the phone. So the next thing we see are the peripheral vasodilators, and they include some of the beta blockers and also hydralazine, if you remember. In both of those categories we talked about when we talked about blood pressure. So these work rather than affecting all of the arteries, they work specifically in the arteries of the arms and legs. So they dilate the arteries, open them up, and then that allows the blood to circulate better to the arms and legs, and that is going to lower blood pressure and also increase the ability of the oxygenated blood to circulate. And so that's going to benefit the heart and help prevent or treat angina. So we use nitrates such as nitroglycerin for acute and chronic attacks of angina. If somebody knows that they have a history of angina, usually with exertion, they might have a PO form of nitrates, or they might have a patch, transdermal patch, or the cream, the lotion that you put on with a little paper. And if they get just acute attacks of angina that come on when they're not expecting it, then they can get the nitroglycerin that goes under the tongue, and it works very rapidly to expand the arteries. Any form of these helps to reduce how hard the heart has to work. It decreases both preload and afterload, and so the heart does not have to work quite as hard to get oxygenated blood circulating. Calcium channel blockers will relieve the pain of angina. They also are used both for hypertension, like we talked about before, and you'll see coming up that we use it to treat cardiac dysrhythmias. Peripheral vasodilators work for high blood pressure, and they also can sometimes treat the pain that people get in their legs when peripheral blood vessels constrict. A lot of times, as age tends to bring about more changes in the veins and arteries of the legs, there will be vasoconstriction that causes discomfort when the person tries to walk. And the peripheral vasodilators, such as hydralazine, can sometimes help this in the early stages. This is a picture of that someone brought me from a local hospital where somebody was having a heart cath. And you can't really tell from the picture on my phone, but when you look closely, you can see left anterior descending artery, there's a blockage, there's an occlusion, and it's preventing blood from going to a certain part of the heart. And this shows by the arrow where some compensatory blood vessels have grown excuse me, in response to that lack of oxygen and possibly taking nitroglycerin. And you can see, if you look closely, little bitty blood vessels that have grown around there to try to make up for the fact that the blood vessel is occluded. And so the heart has a tremendous ability to do that over a period of time, but it can't do that indefinitely. And eventually there is going to be some lack of oxygenated blood, and when the heart muscle senses that, it causes the pain of angina. When it comes to the nitrates, the primary side effect that somebody's going to notice right away is flushing. Because of the vasodilation, they're going to feel, particularly their head, just kind of feel heavy and sort of flushed. Generally, there's going to be a nitroglycerin headache because blood is rushing to the cranial arteries. That can cause postural hypotension, so that's a danger. It's best if the person is sitting or lying down when they take their nitroglycerin. there can be some other side effects, but what you're going to see immediately is that flushing and that very heavy, sudden pain in the head. It used to be that when people took nitroglycerin and put it under the tongue, it would cause immediate burning under the tongue, and that's how you could tell that it was still good, because nitroglycerin doesn't last long. It only lasts for about 90 days or 3 months. So when people felt that burning, they knew that the nitroglycerin was still good. That is no longer the case because there has been a change in how they make nitroglycerin. So sometimes you might get a burning in the mouth, other times you might not. So you wouldn't want somebody to throw away their med just because it didn't make their tongue burn. If you look down to where I have the patient teaching, you see that I wrote a little poem just for this. Throbbing in head, still a good med. So the best way to tell that the nitroglycerin is still good is it's going to cause that immediate flushing and that headachy feeling in the head. You want to avoid alcohol, which is a vasodilator, and you also want to avoid drugs for erectile dysfunction, like Viagra, because they also cause vasodilation, and too much vasodilation can lead to just a bottoming out of the blood pressure, and that can be very dangerous. So go back up to where I have administration of nitroglycerin, box 8-4 on page 148. So you need to check this out. There are steps to taking nitroglycerin, whether it's sublingual or the nasal spray, for a person with chest pain. They can repeat it usually up to 3 times and redo it, take their initial dose. If no relief of chest pain, then repeat in about 5 minutes. Still no relief of chest pain, they want to repeat it a 3rd time. But if they still have chest pain after 3 administrations of nitroglycerin, they need to get to the emergency room, preferably by calling 911 and letting EMS handle it, because they have the medications, they have the oxygen, they have everything that's needed on the ambulance. Whereas if somebody drives to the hospital, they run the risk of passing out, or their family members driving them and panicking, maybe having to give CPR by the side of the road, which actually happened to a former coworker of mine who was driving her husband to the hospital for chest pain, and he coded, and she was trying to give him CPR on the side of the highway, so he did not make it. So it's best to call the EMS and let them handle it. For peripheral vasodilators, also going to see headache, also going to see flushing, as well as some other side effects. But it's kind of the flushing and the headache and the dizziness and syncope from the blood pressure dropping. If a person has nitroglycerin ointment that they squeeze out onto the little nitroglycerin papers, they need to keep that in the refrigerator. They need to tightly close that bottle of ointment or the tube of ointment, keep it in the fridge. If you have nitroglycerin tablets, you want to store the tablets in a dark glass bottle. Take out the cotton, because the active ingredient can evaporate into the cotton, and that takes away from the medication itself. In the ATI book, on pages 169 to 171, they talk about anti-anginals, and they also give a lot of good information that you can use from that book.